thank you everyone who's here today. For those of you who this is your first lemonade stand, we started this at the beginning of last year during the start of the pandemic to kind of capitalize on everyone being stuck at home and to create opportunities to not only get together and spend some time just hanging out like we've been for the last few minutes, but also to explore different aspects of the male birth control ecosystem. So I'm Kevin Shane, the Marketing and Communications Director for MCI. We do this every month, so those of you who have registered, will be sure to add you to our mailing list so that you can avail future offerings. We also record these, so you can find previous editions of the Lemonade Stand on our YouTube channel as well as our website. And we'll be sharing this one, soon after we complete today's activities. Just some housekeeping. We request that you stay muted during the presentation. And then at the end of the session, we're going to set aside about 10 to 15 minutes for Q&A. So you can either, add questions in the chat, or you can raise your hand and we can have a nice little discussion. These are intended to be kind of, laid back affairs and more conversational. So yeah, but without further ado, I think today I'm particularly excited because we have Steve Kretschmer from DESIRELine to really take us through the importance of market research. As those of you who are in the male birth control world are well aware, one thing that we constantly hear is this question of whether or not there's actually demand for male birth control. So it's going to be great to hear what Steve has to say. We're collaborating with Steve and his team on an international market research project later this year or early next year. So we certainly love his work and we're big fans of his. So I think today is going to be very exciting. Yeah, and without further ado, I'll hand it over to Steve, and then yeah, at the end of the session, we'll have a little Q&A conversation. So Steve, take it away.
Thank you. Yeah, and the feeling's mutual. Love working with you guys. Amazing work. So what I've done is kind of put together a number of thoughts around understanding demand and how we can use market research to assess demand, and then really the question I have for all of us, and I think we need to address within the sector is how can we help move towards more demand-inspired technology development, really in contrast to technology-led. So that's what I'm starting with here is how do we help support making that shift? There needs to be some level of tech-led aspects to this, because this is new technology. You're going to identify what potential targets are possible, but to the extent that we can put demand out in front of that searching, if we can understand the attributes or the various product characteristics that CT development can chase, we're much more likely to succeed eventually in uptake and use. And when we are essentially trying to develop the products, throughout the development process, there are opportunities to make trade-offs or make choices about the attributes. It can be, what form is it going to take, or potential forms are it going to take, the duration. We're chasing realizing clinical efficacy and safety within a product. But in that process, if we understand already what people want, when we go through the process of making those decisions, we can actually put the demand out in front of those decisions where the trade-offs need to be made. What I'll do is just walk through several areas. Some of them are market research specific areas. Some of them are frameworks for kind of understanding and framing why the research even matters. I'll start with just framing the possibilities when we think about what's possible for contraceptive technologies, a way to frame this to understand what all the possibilities are using a product tree. Then I'll talk a little bit about demand, really what it is. Many of us may understand a lot of this already. Within the development sector, I think in general it's less well understood. But talk about that, go into how segmentation works, and how we can account for and assess what different people want and who they are. Then looking at the opportunity to do research, and this comes from the work that's underway already. This international research assessing the demand for male contraceptive products, putting out there kind of an initial set of attributes that we're exploring, and maybe getting everybody's feedback on those during the discussion as well. Finally, demand forecasting, so approaches that can be used to actually forecast uptake of potential products that really can allow us to be able to understand what the demand is and size that demand, and do so by segment so that we understand who wants what. So ultimately, any given developer may be focused on a particular target, a particular product. When we look at it across developers, eventually we're looking at it at a portfolio level. What's the portfolio that is of products that are going to really meet the various different segments of demand? And then we can talk about this and discuss. So starting with contraceptive product tree, essentially, if we really think about it, all contraceptive technology development possibilities can be defined by 4 attributes to form what we call a product tree. So the first one is the users. There's really only 3 possible users in essence. So women, men, or there could be the possibility of some sort of dynamic couple option. The next attribute is time of use. Typically, this is boiled down into 3 categories: on demand, of some kind of short acting use when needed, continuous of any kind of duration, and then permanent. The third one has lots of different possibilities. This is a mechanism of action. I think what's interesting to think about and understand with this as an attribute is, whatever the mechanism is, and accounting for dosing options, you're also going to have what the efficacy and side effect profiles look like. So when we've landed on a mechanism that and with specific dosing, you're going to end up with what the efficacy and the side effect profiles are. Sorry. And then the last one is form of use. So what are, again, many possibilities, but you can look at differences in multiple frequencies of use. So you can have a form like an injectable, but an injectable is once a month, or once every 3 months, or 6 months, or a year, or whatever. So accounting for different frequencies within the form, if you take any contraceptive product, you at the core is going to be some combination of these 4 attributes, and how they play out then in terms of other characteristics like efficacy and side effect and frequencies. And at least at the cross developer level, what we're looking to do is identify and nourish these branches that have the greatest potential, and trim early those that aren't going to flourish. So when we look at this, is through the demand lens, but ultimately, if we're developing something that may be very promising on the technical side, but nobody wants, in the end, it's not going to be useful. If we are developing something that might be quite difficult, but everybody wants, there's at least that big opportunity at the end. Just to give an example of this, so these first 3 branches, for example, looking at the kind of first level, then you can start to place within each of the attributes, the different times of use, the mechanisms of action. And then there's always the opportunity to add additional characteristics. So we just add that as like a whole nother kind of level. If you look at MPTs, well, MPTs are some combination of these other 4 attributes plus, protection from STIs, HIV, etc. This gives us the ability to be able to frame, what are all the possibilities? Because we can be going down a certain path, and if we're, traditionally, for example, a lot of the development tends to focus on, what works, what can we do for women, what can we do for men? But are there opportunities that are at the couple level? Whether it's some sort of layering, so maybe what we can realize for the woman isn't a threshold of efficacy, say, that's high enough, and maybe for the man as well. But if we were to layer them, it might be possible to reach the efficacy level that we want through some sort of combination product. If we don't use this frame, we may never recognize that there's this entire branch with all its sub-branches on it to explore. Next, I'll talk about demand, and as a part of this, what we call the adoption pathway, product or service adoption. So the first thing, and this really comes strongly from the development sector, perspectives in the development sector, which is, who are our beneficiaries that we're looking to support? And I think that it's important to clarify the terminology that we use with regard to the people that we're looking to serve, because essentially beneficiaries implies that people should be or are passive acceptors of what we make available to them. The reality that we know from experience, though, is that's not the case. So our market experience shows us, whether it's in the development sector, the commercial sector, et cetera, shows us that people are not passive. They have and they make choices among different options, even if that's to just completely ignore what's been made available to them and do nothing, right? So we have all kinds of contraceptive technologies that already are available, especially on the female side, and there are many, many people who don't avail themselves to any of them, even if they are available to them, right? So they're making a choice to not use a product, and for various reasons. And so, it's important, I think, for us to think in terms of customers as opposed to beneficiaries, because they weigh their options, even if non-consciously. So it may not be this conscious decision. What we've seen now in the development of behavioral economics, behavioral science, is most of our decisions in our behavior are not grounded in conscious decisions. And they're choosing and behaving according to what they feel is in their best interest around their needs, their wants, their aspirations, and the context in which they're making those choices. It's also important to recognize that the customer is not always the user, right? So if we look at the development of contraceptives for women, it doesn't mean that the woman is the only customer in the mix. The customer really, in some sense, is the relationship, whatever that relationship is. It can be a couple, it can be a committed couple, it can be a non-committed couple, it can be, just a one-night stand. But it's that relationship that is actually the customer, and we need to look at the relationship level, the man, the woman, and then understand all of the influences that others have, and that is part of what is the lived context. So behavior happens within a context. If the context is different, you're going to have the same person in two different contexts, and they will behave differently in those two different contexts because of the nature of the context. And so what we'll see is we get different dynamics in different contexts. The next thing I think about demand is, and again, this is coming strongly from kind of a counter to the way in which in the development sector, there's a lot of talk about generating demand. We have this solution for people to improve their health, to help them prevent unwanted pregnancies. Now we need to generate demand for it. And in fact, we don't generate demand. We can't. We can only align to it. So demand exists in people, either consciously or latently, in the form of needs and wants and aspirations. So, whatever it is that we want in the given context at that moment is the demand that we have in ourselves. In order for us to be able to have people use our products, use our services, what we need to do is understand that demand within the target populations that we're looking to serve or provide products and services to. And this is really kind of the underlying foundational principle of human-centered design. We put people at the center, we understand what it is that they need and want and aspire to. We then design products to that demand. When there's often, I think, this argument made, but what about marketing and all of these approaches that create demand for the products? They don't create demand. What they do is they communicate what are potentially seen as the value of those products. Here's the benefits, here's the cost, here's the et cetera. Here's the value of what this product could be for you. So all they're doing is communicating what the attributes of the product are. If that communication is accurate and matches the demand, if those product attributes match the demand, what people need and want, then they take them up and they use them. Good products and services promote demand. So the better that the product is, people are looking to use it more, even look at even ways in which they use it differentially, and demand prompts supply to meet it. So, stockouts will cause increased production and increased supply in most cases. One of the other things I think that's critical to understand is that customers view supply as a competitive set. So, and again, this is even if one of the competing options is to do nothing. So when they see something, right, they're looking at what are the other options available to me. I could do nothing. I could use something else. All relative to what their demand is, what their underlying needs are, what their underlying wants are. And when we put our product, our service out in front of them, they're going to make a choice looking at that relative to what their other options are. So we have to understand what those are in order to be able to really understand demand. And understand what the kind of final result's going to be in terms of uptake or use of the product. This is a basic product or service adoption pathway. Really looking at this from the commercial sector approach, but essentially uptake and use of products or services bridges multiple behavior gaps. And usually from the demand perspective, we're going to understand demand. We need to apply different types of research for different parts of this pathway. So we start with awareness. Are they even aware of the product or service? Do they understand and relate to the value that it might bring to them in their lives? Eventually, do they try it? Confirm that it's meeting their needs, and then continue to use the retention, and do they even advocate for it? So awareness and comprehension or value recognition is essentially, interest. What is it? Are the benefits relevant to me? If yes, leading to conscious or non-conscious intent to use. This is something that I want or need. That goes then to, trial. Is it worth trying? Should I try using it? What do I expect? How is it going to meet my needs? And then use. So the user experience, am I getting what I expected, what I need, what I want? Is it easy? Are the benefits outweighing the costs? And then in terms of advocacy, is it so good that I think others should use it too? Am I willing to put my reputation online to tell others about it? In terms of gaps, when we have high awareness but low intent, there's essentially this knowledge intent gap. Usually that means there's a lack of relevance, or somehow the benefits that should be relevant have not been clearly or well communicated. The next one is the intent action gap. I want to do this, but I'm not actually taking action and doing it. We see this with ourselves in terms of dieting and exercise and stopping smoking, et cetera, et cetera. I really want to live more healthily, but I can't bring myself to do what is necessary every time to do that. Then there's the trial usage gap. So I try it, but then I don't continue to use it. So this is where non-adherence occurs. And then finally, the use advocacy. I use it for myself, but I'm not willing to communicate to others. Like, why is it that I want to keep it private to myself, that I don't want to put myself out there? When we look at this in terms of generally what's driving interest, trial, and use, it's marketing that is driving the interest. So when we communicate the benefits, that is communicating what they should be aware of and helping them to understand the value. It's, value proposition. How do we market the value proposition of this product? Then trial is typically driven by this combination of marketing as well as core product attributes. So what are the specific product attributes? Maybe it's a form of use, for example, for a contraceptive that, that and efficacy, for example, I think I can use this and it's going to protect me. That combination, I'm going to give this a try. Then it's the full user experience. So, I experience all kinds of side effects, then like this isn't working for me, or hey, this is really working great for me. And then what we tend to see is this evolution, within the market. If people are trying and using something that's really working for them, then you get this word of mouth spread. So you typically have early adopters adopting the products first. If they experience a good experience, they will communicate back, and then the laggards will join. If they experience a bad experience and they communicate that, then your uptake curve for the product will peak. So I'm going to give an example of the kinds of specific contraceptive products, product attributes that differentiate across this path for women's adoption. I'm doing this because there are so many products out there, and there's a lot more information, understanding of specifically what is driving. But essentially, when we look at interest, it tends to be kind of the time of use that's driving interest. This, is it on demand or continuous use? What do I kind of basically need as a core opportunity to use it, a basic need, need it, from time to time. So I'll use on demand, or I need some continuous protection, or I'm just done with kids. I need something permanent. Trial tends to be driven by form of use. So, can I see myself using this? Is it worth trying? This is an example of where vaginal products tend to have a very low trial, even where intravaginal rings can have among the small group who will try them can have very high retention. The trial, especially in low middle income countries, is extremely low, and your use is essentially the proportion of that try times the proportion that continue to use, that were retained, and that's going to be what your full use is. So if your trial is very low, you'll never get to high levels of use unless there's some sort of dynamic that occurs where the initial trial is very low and the experience is amazing, and then you get this ramp up of that word of mouth. But it's pretty rare that you have a huge fluctuation like that, because the basic attributes, particularly in the form of use, is going to drive some level of trial. And then lastly, the mechanism of action is also what tends to drive continued use, that user experience. This is where we see with hormonal products among women struggles because of the side effects. So I'll try this daily oral pill, or I'll try this injection, but then I can't stick to it. It's just I can't deal with these side effects, and so I'm dropping off. Now we need to kind of understand this demand, and so here's where I'll start to talk a little bit about approaches for research. So, we've got our customers, the relationships, the women and men within the healthcare context, and to some degree with contraceptives. You've got other customers in the mix as well, which are important to consider. Healthcare providers, where they are necessary, pharmacists, community health workers in lower income countries, the payers and the regulators. Early in the process of development, before you launch, you've got to get through at least the regulation, and then on an ongoing basis, there's going to be payers as customers. What's the value for them in terms of in the U.S. how they tier the coverage? There's two sides to this. So one side is, what are the unmet needs and desires? So we really can look at this through an exploratory research lens. What are the conscious or non-conscious or behavioral attitudes and perceptions and norms, biases, heuristics, all of these various pieces that essentially boil down why there's demand. So they want something, they have a need, they have aspirations. What is, why is it that they have those? Here are methods that we can apply, or applied behavioral science approaches, ethnography, in-depth interviews, focus groups. We can do quantitative surveys of different types. But the other side of this then is potential product attributes. So here we can use experimental research. So on the left-hand side, what we're doing is trying to uncover what are the needs. And if we understand what those needs are, how might we meet them, or what attributes or products might support meeting those needs. But we can also do it the other way around, which is, here's some product attributes. Let's experimentally put them in front of people and see what they do. So here we can use conjoint and discrete choice, simulated test markets. Here, what we're usually doing is not asking their preference, but actually deriving the preference. So having them make a choice in a simulated test market scenario, have them make a decision, choose something. And what we're able to do then is go back in the data and derive what aspect, what part of the product profile, for example, was causing the preference. We can get into then demand forecasting is often where that ends up, to basically say, here's the size of the pie, here's where this can go. So really looking at preferences, trade-offs, willingness to pay, forecasting uptake. So just to summarize quickly, our target populations are customers. They're choosing what they want. There's a decision dynamic that often means that we need to look at a relationship and others involved and their lived context in order to understand that dynamic or underline what's going on there. Demand is not created, it's latent in people. And we really need to understand that demand and align our products and services and interventions to it if we want them to be used. The adoption pathway has three key phases. This interest, which is really driven by marketing communications, what the value of the product is, trial based on the basic product attributes, and then the retention based on the user experience. And we can really assess this demand from two different angles. One is really exploratory and the other experimental. When we combine those two together, we can actually mix and match and identify what parts of the underlying need are being met by which attributes. Segmentation, I'll cover this pretty quickly. Some of this is a little complex in terms of the slides. But fundamentally, it's understanding that when we look at demand, okay, we understand that there's this latent demand in people. What is it? What do they want? The added complexity, of course, is that different people want different things. There's different latent demand in different people. However, if we identify ways in which to group them according to what they commonly want and how they differ between each other, we can actually segment and say, well, let's develop this for this group and that for that group. So typically when we segment, our starting point is really the underlying decision or underlying value of that decision or choice or behavior. And so in this particular case, what we would want to look at, first of all, is what's the lived context that men and women have, and at the relationship level. We'll look at both men and women each as well, but particularly looking at the relationship level. And beyond just what they say is their needs for contraceptives, but if we think about family planning in a broader perspective, right? So if they use contraceptives, they're able to plan their family. If they're able to plan their family, what are all of the different benefits that they can enjoy? Well, that's beyond just not having a child when they don't want to have a child. It leads to opportunity, financial security, education, health, being able to achieve life aspirations that they might not otherwise be able to do with more children than they plan or can afford to support. Family resilience, family harmony, self-reliance and self-efficacy, social harmony, and transgenerational resilience. This is something that we've seen, especially in recent studies that have shown that when family planning is used in one generation to be able to keep the number of kids within the what's able to be afforded, next generation benefits from those decisions. And so if we look at this through this very broad lens, what we can start to do is break it down and basically identify what kind of segmentation solution can work for understanding the differences between different groups that have different needs or wants or aspirations. I don't need to get into the detail of this particular slide, but essentially there's lots of different aspects that we can explore and measure. We can use a couple of different types of approaches for segmentation. A priori basically says, okay, let's decide up front on what we're going to segment on. We're going to segment on, certain demographic characteristics or life stage or something else, and basically be able to divide people up and then look at, say what they want or how they behave, differentiate according to those basic divisions. That tends to be easier to develop, but much less predictable of needs and wants and behaviors. Then there's post hoc segments where basically we take the data, we measure all this data quantitatively, and we put it through hierarchical clustering or latent class or k-means types of clustering algorithms, so machine learning algorithms that actually identify how the data groups together, which respondents are similar to each other within segment, but very different between segments. We get these clusters and we can profile those clusters to a bunch of crosstabs and say, this is this group, that's that group. And now the data has derived and often on kind of a complex set of variables, what the underlying differences are. And then we can look at, all right, what's the demand for different products attributes, or based on understanding that exploratory underlying needs and wants and aspirations, what's the demand for the attributes and products. We typically do this just in two main stages. One is, qualitative deep dive to unearth what the various aspects that we should be measuring in the quantitative, and then quantitatively measuring those and using these cluster segmentation algorithms to cluster the data. So different people have different latent demands. Segmenting them by the drivers of their demand allows us to be able to differentiate those segments on what specifically is driving those differences, so that you can specifically then target the demand with solutions interventions. There's no one way to segment. So the best, the right segmentation is one that's actionable. Tend to, just in the analytic approach of this, do a lot of competing models to identify the one that's going to work best for what it is that you're trying to solve for. We can develop nuanced, deeply predictable data-driven segmentations that are at their underlying understand, account for the lived context of men and women and their relationships in order to be able to better inform targeted contraceptive technology as well as family planning support services. And use of family planning is happening in relationships, so we need to segment at the relationship level at least, if not also at the man and the woman. We'll jump over quickly to male contraceptive product attributes. So through a good 30, 40 interviews so far across developers and funders, we have identified kind of an initial set of various attributes by which we can start to kind of define the development horizon to be able to assess demand for them. We'll be doing this in this quantitative research that's coming up. The first 4 attributes are looking really through the lens of the form, the time of use, and duration. So how do I take it? Pill, a gel of different types, different patches, injection, implant, nasal spray, the procedure of some kind. And I would encourage anybody who has other ideas about any of these as I walk through them to post in the chat, but you've forgotten this form, or oh, you've forgotten this duration. Can you account for that? Please do that, and we can work it into the research. How often that you need to take it, only when needed, that on demand or daily, weekly, some form of, in the months range and years range, or maybe only ever once. How long before it starts working, kind of short to longer. This is on the horizon, so 12 weeks is kind of on the longer horizon of what's in development. Can be that there's potential for products that are longer. How long before it stops working, kind of similar. Then we've got how does it work? So this is getting at the mechanism of actions, and then, as I said, side effects flows from that. All the main approaches: stopping sperm from being made, stopping sperm from moving. We're putting all of this in consumer language. Blocks the sperm from reaching the egg, changing the shape and functionality of the sperm. The effects on sex: the testes shrink by a bit or shrink by half, no ejaculation, orgasm, or less fluids, less feeling during sex or more, lower sex drive, higher sex drive, reducing erectile dysfunction or protecting against STIs. Then changing how I look: acne or skin rash, weight gain, stronger muscles. We're looking at this through both the negative and positive lenses. So there are benefits in some cases. Changing how I feel, a number of different areas, and then other possible side effects like changes in color of the urine, lower blood pressure, increased cholesterol, improving prostate health. Then lastly, there are a number that we've identified that are form specific. So, if it's a pill, do I need to take it with food, or I need to take it without food, or I need to abstain from alcohol? Injection or implant, or a procedure: is there site pain or infection risk? Post-procedure complications of various kinds. Regular sperm count monitoring: would that be at home, or does it need to be in a clinic, or does it require, the procedure require some removal, or is it biodegradable, or different gel complications like transfer to a partner, or the odor, or the messiness, etc. So this is just an initial set. Anybody's input or feedback, or we can discuss some of this during this discussion. Lastly, I'll talk a little bit about demand forecasting. So this is approaches for really sizing the market when we use quantitative research as approaches that we can take to forecast demand, and then we go all the way through to kind of sizing that. So this is a bit complicated, but just on the left-hand side here is the research that is that experimental research that I mentioned, that it was on the right-hand side of the other slide, where we basically are taking the attributes of the product. We're using, you know, different types of discrete choice or conjoint, or you can do monadic product profile tests. We're using simulated test markets. So we're not asking them, what do you think of this attribute? What do you think of that attribute? We're putting something in front of them and asking them to make a decision about it. That decision might be, you know, just how likely are you to use this versus what you're using now. But we're putting it as a whole profile. Using discrete choice or conjoint approaches, those methods on the back end, we're able to actually untangle those the desire for the different attributes and identify actually at the respondent level the utility, relative utility of each of the different attributes and each of the different levels. So if I were to go back really quickly to say this slide, you know, let's try this one. So how do I take it? How important is the form versus how often I have to take it, or how long before it starts working, you know, versus how long before it stops working. I can actually identify, you know, how do I take it is 3 times as important as, say, how often I need to take it. And then within each of these, we can actually, you know, identify what's the relative preference. You know, maybe a pill is, you know, 4 times more preferred than an implant, and you know, half as much as a patch. You know, so we actually can quantitatively assess those relationships among the attributes, and then we can pair them up. So essentially, we're creating this giant regression model, and we can basically say, okay, if the product is this set of attributes, it's a pill, it's only when needed, you know, starts working within 30 minutes, and lasts for a day, and you know, stops sperm from moving, let's say. You know, maybe there's lower sex drive, weight gain, mood swings, etc. We can actually calculate out what does that demand look like for that product versus if it was some other combination. So using this approach, what we're able to do is actually assess what the demand is for all of the different potential products and the relative demand for the attributes. Now, what's important, and particularly in this case, is we're developing products that, you know, their horizon to market are in the 10, 20, 30-year range. Well, by the time we get there, the population is going to be quite different in many of the countries. And so we can do population projections, take that demand, apply it to those population projections. That is, you know, assuming that what we've done in this demand, this quantitative demand research, is ensure that we're collecting that data in a way that is nationally representative, geographically representative to our target geography. Apply the population projection. Then what we do is take this information and we can go to procurement decision makers, regulators, and basically say, if this is what the demand were for these products, what decisions would you be making? You know, you've got a fixed amount of money to spend. If this was available, what would you trade off? What would you not buy, and what would you buy? When we do these demand forecasts, we can also do that at the respondent level or the relationship level. Be able to say, okay, you said that you are very likely to use this product instead of what you're using now. Well, when we do these calculations, we're able to basically say, well, here's your source of share. Here's the proportion of people who are not using anything who are now going to use something. So we've increased use of modern contraceptives. Here's the group that were using this female method, but now we're going to switch over to the male method. Here's this group of men who are going to start using one, but the woman is still going to be using something, etc. We can actually map all of that and take it to these procurement decision makers and say, if this is what the market would look like if these were available through the demand lens, you know, tell us the kinds of decisions that you would make. They may not make it directly according to that demand. They probably should, but you know, what are they going to do? Right now, the way that a lot of this work is done is we say, hey, there's this new product coming. We go straight to procurement and we say, how many of these are you going to buy? You're the, you know, such and such country, you're making these decisions for the purchasing. This is going to be available now. How many of these are you going to buy? We look at female condoms, often the way in which they're communicated as having been so successful is because so many countries bought them. That has nothing to do with the usage. Much of the usage, for example, for female condoms were used as gloves to dye hair or to clean a bathroom. When we have basically taken that demand, then applied the population projections, then understood procurement decision making, we can then actually model what the impact is going to be. So essentially, then what we're looking to do is, if we can account for these needs and preferences in the process that the technology is being developed, what we can do is ensure that the decision making through the process of the technology is accounting for what the needs are. We're basically optimizing our product for those preferences, both to, you know, in order to identify the potential for new contraceptives. And this is where if we identify an unmet need and there isn't anything that's being pursued right now to meet that, maybe there's, you know, we start to think outside the box what we could be doing differently on the tech side to develop to that, or optimize what we already have, or prioritize in some cases for looking across different potential products in development. Sorry, I kind of rushed through some of that, but we could go into discussion, and I don't have a clock in front of me. How are we doing on time, Ken?
Doing great. We've got about 10 minutes left. So thank you very much, Steve. That was fantastic. And you may have felt it was rushed, but that was very succinct and awesome. I was messaging Heather on the side saying I could listen to you talk about this all day. So but we do have about 8 minutes now, so we can open this up to questions. If you want, you can just submit your questions in the chat, or what might make it easier if you want to, you know, unmute yourself and ask a question, just use the reactions to raise your hand. Oh, we have a hand raised here. So Brian, go ahead.
Yeah, hi Steve, thanks for your talk.
Hey, Brian.
Yeah. You mentioned that one of the core tenets here, right, is human-centered design. We're trying to meet people's demands or meet people where they're at. And I think that really applies for a lot of consumer goods, but when dealing with a population or public health related good, I also wonder if that is the right approach, right? The understanding that if you think that people are kind of self-serving and self-centered unless they're like educated or externally influenced, right? Then there may be a role for social environmental campaigns to kind of change some of the assumptions or what they believe at baseline that may then impact demand. So I'm wondering if you've considered that or addressed it in some way.
Yeah. So there were a couple of slides I didn't include in here that would get to that. There's a behavior model called the FOGG behavior model, FOGG, it's a decent behavior model. It doesn't explain everything, but one of the things I think that is important that it explains, it basically says, look, there's two dimensions that drive behavior. One of them is motivation, right? So I'm aware of things, and as I'm aware and everything, I'm motivated to actually do this. But the other dimension is actually ease of doing it. And so in what we see, what you have then is basically some threshold across that for behaving. So on the one dimension. You can be all the way in the upper left-hand corner on the, high motivation, low, ease of doing it because I'm so highly motivated, I'm going to behave. Or all the way down on the bottom right, no motivation whatsoever, but it's like right there. It's so easy. I just do it. And then kind of anywhere in between. And I think the idea behind what you're saying is communicate benefits, why this is important, the risk perception, et cetera, in order to motivate people to do this. But the other side of it is actually, how do we just make it easy for them? When we look at, particularly products, what we're seeing increasingly, for example, is a major shift to self-care. How do we just make it easy because they don't even need to go to a clinic? How do we design the product so that it's not painful? They only need to do it once in a while. There's an easy reminder. There's, all of that. And so, and that's where the human-centered design comes in. It's basically, we really understand what the demand is. We can figure out how to make it easy for them, as well as communicate, why they should do it. But it's that combination of both of those that can be helpful.
Awesome. We have a question from Amelia. Go ahead, Amelia.
Hi, thank you so much for this great talk, Steve. And this may have been something you and I had chatted about before, but just wanted to hear, share sort of some thoughts and if maybe others wanted to chime in as well. And I think kind of this was alluded to in the beginning. I'm interested about how sort of findings from this research is communicated and shared with product developers. So product development teams are generally quite different from social behavioral scientists, from people doing some of this demand forecasting, some of that research, and often have very different trainings, very different lexicons, very different ways of communicating and sharing information. So I'm wondering about how really we bring together sort of interdisciplinary groups in really meaningful ways to really improve the products and therefore better meet user needs. Yeah,
no, absolutely. So I think the first core of that is actually applying this lens to the developers, right? Developers are people, they have demand, they have reasons why they're developing what they're developing. If we really understand that, then we can figure out how to communicate why this matters and how it's going to be useful for them. It's part of what we have been doing in this particular set of research. So really trying to scan and talk to every developer targeting male contraceptive, both to understand what it is they're developing and look at how to incorporate those pieces into this research, but also pre-communicate, we're doing this research. What do you need to get out of it? What are your motivations? Are you interested in this from a commercial perspective? Are you interested in this from a philanthropic perspective, et cetera? And so we're looking to try to communicate it that way and work out how even they're best going to be able to digest the information and work it into their product development. It is probably one of the hardest parts of this, and we have to be very conscious of the trade-offs that they are weighing, which is it's already hard enough to develop this product. Now to tell me that the easy path to develop it is not what people want, and I got to go down this hard path if I want to double the uptake, for example, you're making it harder for me. I could have on the other hand, what we're going to say is, yeah, but at least you're finding that out now rather than after you've gone to market and nobody's using it.
We have a question here in the chat. Just have you considered people who don't identify as a man or a woman when segmenting populations?
So absolutely, and that can definitely be part of this. I think ultimately on the contraceptive side, it's just going to come down to, so we're looking at it from physiologically, is this working on sperm? Is this working on an egg, or the male or female reproductive? Which side is it working on? But from our perspective, yes, when we look at it from even at the relationship level, right? Doesn't have to be a traditional relationship. And part of this is having that, and we very consciously use the term relationship instead of couples. We're not assessing couples because they're not always coupled. And so looking at this from a relationship level on different kinds of relationships, but absolutely. Yeah,
and we
thank you
have,
for raising.
no worries. Yeah, we have a question from Carolyn. This will be our last of the day because we're running out of time. But go ahead, Carolyn.
Oh, great. Hi, Kevin and group, and hi, Steve. I was listening to you, and as I was listening to you about your marketing, when you were talking about the marketing part, I thought about really home shopping networks. If you think about it, the knowledge, intent, and how they do as far as getting people to talk about their product. Did you like it? Would you recommend it? So I like, from that perspective, I really like that. And I think this is would be a good step moving forward when you're planning your marketing schedule.
Yeah, that's true. And there's a third aspect to the FOG behavior model, which is a trigger. So basically, if you have you've reached that threshold, and you have that right mix of motivation and ease of doing it, then what's the trigger? And that can be like this person saying, I'm just like you, I use this,
Yes.
and so it's like, there's that social aspect, or call us in the next 5 minutes and we're going to give you this 10% discount. It's like, I got to call now and then I'll get that discount. So
Yes.
you're applying a trigger in order to be able to prompt that. Yeah, definitely.
Yes.
On the marketing side.
Thank you very much.
I actually lied. We've got one more question from Brian in the chat. And it is, how do you reach the payers/regulators in your research? We want for male contraception to be supported and funded, but we can't even get vasectomy funded and made available despite latent demand.
Yeah. So, for the research itself, it depends on the cases. So in the US, the market is so fragmented on the payer side that we can actually even get quantitative numbers in terms of decision makers in the companies that are making those decisions. In other cases, in European Union, for example, you have very few people who are making those decisions. A lot of cases, what we're doing is talking to ex-regulators, so those who have just retired, coming out, and we're doing interviews with them. What kinds of decisions are considered, that kind of thing. And in many cases, it's qualitative interviews, trying to understand the kinds of decision making. CHI is a good example of an organization that does a lot of those kinds of interviews and discussions. And on the commercial side, it's done all the time. But it's networking to them, and there's lots of panels that have been developed to be able to reach them.
Brian, if you want to ask another question, feel free.
No, I guess you mentioned the idea of fragmentation of the U.S. payer system, right? I really worry about that too, and how much this is really a concern for them. Like and because of that, right? How important is the demand research, right? Who's going to read it? Like, I want to believe in it, right? But is it going to get seen by the right eyes?
Yeah, and think about it from the standpoint on the fragmentation. What we're doing is assessing the decision making. So on the payer side, so we will do actually linked models that basically say, this is the decision, this is the demand that the individual wants. In the US, because many of drugs are prescription only, so you've got to get it through a physician. Here's a decision the physician will make. Here's a decision the payer will make in terms of tiering. This has to be used second line after this, that kind of thing. It's not as directly applicable for contraceptive market, but still in terms of coverage, if this is what the efficacy is, this is what the preferences and everything, be able to go to the insurance companies and say, this is what it's going to save you if you make this available. How much are you going to charge for it? What's the copay going to be? How are you going to tier it? And we're able to take that information then back to the developers and actually say, here's what your market size looks like. Here's what, how easy it is going to be able to get and be covered versus not, versus like it's going to be super hard to get covered and people are going to have to pay large copays and all that.
Just wondering, what are the health outcomes, consequences data that you need make that argument with insurance payers?
Yeah, so that's part of what we assess is what the decision making is. So how much of it is efficacy, is safety, is they're of course making that decision in a competitive context. So what are they paying right now for those other drugs, and where is this going to fit in that? So this is the core actually when we do those interviews of what we're trying to understand is actually what they're accounting for. And it will differ from product area to product area.
Yeah, I just see you hitting that wall of, well, this comes at all risk to men taking this drug that prevents pregnancy in women. You know, how do they rationalize paying for that, right?
Yep. It's true.
Yeah. And then I guess if I can ask another question.
Go for it.
Okay. I'm very interested in this market research on men, and I do think that when it comes to behavioral surveys, right, you can only really answer questions based upon the context in which you understand it. And if a lot of men don't have like a contraceptive palette with which to begin to judge various attributes because they've never thought about it before, are we really getting like good data?
Yeah, so what we're getting is the understanding of what the market looks like today, right? As opposed to 30 years from now when there's like 6 products out there, and men have become used to the different options. So we're getting something that's accurate. It's going to be reflective of their options today and the decisions they're going to make. The question is, for how long is that data accurate? And when do you need to go back into the market to be able to reassess because the market itself has shifted? But for, these kinds of things, it's going to be a while. Usually that data is stable for a good, 5-10 years before you need to refresh it.
And do you have an actionable segment in mind that you think would be able to answer these questions regarding your market, or do you feel as if it's or is your approach going to be more general?
It's going to be general. So what we tend to try to do is cast the net wide. So we don't target very narrow segments to begin with, unless for whatever reason that is the target user group for a product. But we cast it wide. Who's kind of everybody who potentially could use this, and then segment that group based on the data. Now we know, okay, here's the group within that group that want this. Here's the group within that group that want that, and we can profile them and but let the data tell us. And if we cast that net wide, so like in the case of this research, it's essentially men who are 18 to 49 who are sexually active within, say, like the last year. Maybe even part of what we're looking at is they have had a vasectomy, but maybe within the last 5 years, where we want to actually understand, did you get the vasectomy because you didn't feel you had any other option? Like if this option was available, would you have not gotten the vasectomy and you would have used this? We actually want to measure some sense of those who have gone through, contextually, gone through the decision of getting a vasectomy. If they think back, would they have not gone through it if a different option was available? If there's only condoms and vasectomy, would they do something different? So we're casting like a really wide net, and then we let the data tell us how does it parse out.
And that kind of sounds like you are targeting then to vasectomy or like condoms or withdrawal.
So what we're doing is we're basically saying everybody, including those who have had vasectomies in the last 5 years. So it's real wide, and then we'll just kind of see where do those vasectomies fall out. Probably some of them are the data will say they were always going to get a vasectomy and they're happy with their decision, and then some of them are going to be I would have totally done something different if it was available. And then what we can do from a forecasting perspective is say, had this been available, here's actually what the trade-off would be on the vasectomy side, as well as condoms and the female side.
And lastly, how do you prevent a selection bias?
In terms of the research. So so that is more difficult in a market like the US because people just have the ability to be able to just like ignore and not participate. What we do is we try to go through multiple channels to recruit. In lower income markets, it's actually very easy because people tend to be quite interested to talk, offer a small incentive. They're even more interested to talk. And there we'll literally go and do a house by house listing of an enumeration area, and then randomly select houses that are eligible and then do the research. So the refusal rate is like usually less than 0.5%.
Thanks for all your questions, Brian. That was awesome.
Yeah.
But then,
and we're working on the list, the other list that you emailed as well. So we'll come back to you.
We can have another conversation.
Appreciate it. Yeah.
Make time. Thank you.
Yeah, and thank you very much, Steve. This has been fantastic and very engaging. So, and thank you all for staying on a little later than we didn't initially planned. But you know, it's always fun to get together and kind of talk through all the different aspects of our work. So. Thank you again, Steve. Thank you, everyone, for attending. And as I said before, we'll be sharing a recording of this on our YouTube channel and on our social media. So please keep an eye out for that. And Heather, did you have anything you wanted to add? No, great.
Thank you.
Thank you, everyone. And
thank you.
We'll see you next month for the next edition.
Great.
Cheers.
Bye.